Hello guys, welcome all of you to today's PYQ Shots, and let's begin with today's question, guys. A patient was given an anticoagulant for prevention of DVT, deep vein thrombosis. He developed following symptoms in image. Which anticoagulant was he started on? Look at the options. Option A, heparin. Option B, warfarin. Option C, apixaban. Option D, argatroban. This is one of the latest PYQ of NEET PG. The image was given. Now pause the video. Let me know the answer in the comment box. Then we'll begin the discussion. Right. So coming to this question, see what is this called as? It is called as purple toe syndrome or purple foot. And this purple discoloration is seen with warfarin. So answer is option B, warfarin. Why this discoloration is seen is because warfarin can induce cholesterol embolization of your blood vessels, and that can cause purple discoloration. And warfarin can remove this cholesterol from your blood vessels, that can embolize these small blood vessels, and it can change the color of the toe. Now that is what is seen here with warfarin, and there's the answer. What are the other PYQs which have been asked with respect to warfarin? Let us enumerate those PYQs. Warfarin, PYQ number 1. Which of the following anticoagulant is a vitamin K antagonist? Warfarin. Second, what factors decrease with respect to warfarin? 2, 7, 9, 10. PYQ number 3. What is the first factor to decline? Your answer is factor 7. PYQ number 4. What is the last factor to decline? Your answer is factor number 2 is the last to decline. Other PYQs, warfarin, they ask you, PYQ number 5, that is, what is the anticoagulant of choice to prevent thrombosis if the patient has mechanical valve? Now remember, if the patient has mechanical valve, then I'll use a drug, reverse M, and what do I get? W. If mechanical valve, I'll use warfarin, right? And if there is native valve, then I'll use DOAC, like apixaban and dabigatran, etc. But if there is native valve and severe mitral stenosis, then again I'll use warfarin. There is another MCQ. Plus, if my body makes lesser urine, renal failure, then I'll again use warfarin. So M for makes lesser urine, M for mitral stenosis, M for mechanical valve. Remove all the M, I get W, that is warfarin. Right. PYQ number 6, with warfarin, they ask you, which of the following anticoagulant can cause skin necrosis? Again, your answer is warfarin. PYQ number 7, which of the following anticoagulant can cause teratogenicity as nasal hypoplasia or mid-facial hypoplasia? Again, your answer is warfarin. PYQ number 8, what do I monitor with warfarin? I monitor PT-INR. PYQ number 9, in case of warfarin-induced bleeding toxicity, what is the drug of choice? Currently, your answer would be PTC, prothrombin complex, 4-factor PTC plus vitamin K. If I don't have PTC, I can go for FFP or fresh frozen plasma. So guys, these are some of the MCQs which have been asked with respect to warfarin. Other options, heparin. See, heparin, one PYQ they have asked is what is the antidote for heparin toxicity? Antidote is protamine sulfate. PYQ number 2, in case of heparin toxicity, I mean, what do I monitor? I monitor APTT. So heparin, or option D, argatroban, that is a parenteral DTI, we monitor APTT. Warfarin, I monitor PT-INR. Heparin, what are the side effects? H for heparin. Remember two side effects from H of heparin. Hair loss, that is alopecia, and hyperkalemia. These are commonly asked. Second, they are asked you which anticoagulant can cause osteoporosis. Again, your answer is heparin. Heparin is not that commonly asked nowadays, right? Option C, apixaban. Option C, apixaban, what can I remember? PYQ number 1, which is a 10A blocker. So remember, Xaban. Ban means block. Xa is 10A. So any drug that is Gaban, it is a 10A blocker. So apixaban is a 10A blocker. PYQ number 2, what is the antidote for apixaban or 10A blocker? Your antidote is andexanet alpha. Andexanet 10A neutralizer. So andexanet alpha, it is the antidote for apixaban. Argatroban, the MCQ that has been asked PYQ is argatroban is what is the drug of choice for HIT or heparin-induced thrombocytopenia, and an answer is argatroban. And obviously, I told you about the monitoring. With argatroban, I need to monitor what? I need to monitor APTT. So these are some of the PYQs they've asked. At last, I'll summarize one important fact here. They ask you for which drugs I do not need monitor. I do not need to monitor coagulation for which drugs. And I'll tell you the clue how to remember. Remember this as DLF. DLF is a builder. And whenever you buy a flat, be it any builder, you need to monitor the construction. Otherwise, they might cheat you. DLF is a good builder, so you don't need to monitor while the flat is being built by DLF. So remember, DLF, drugs where you don't need to monitor coagulation, DLF, D for DOAC. In DOAC, we have oral 10 inhibitors and dabigatran. Second one, is DLF, L for LMWH, and F for fondapatinux. So these are three classes of drugs where coagulation monitoring is not required. So guys, this was all for today's PYQ shot. Tomorrow I'll be back with another question, another PYQ. Take care.